Hello Mr. Ari, I am Dominic John from the Department of Biomedical Engineering, and today I will be using an infographic to talk to you about 3D bioprinting in bone regeneration. Firstly, I'll be introducing to you what is 3D bioprinting. 3D bioprinting is actually a three-dimensional bioprinting which fabricates a 3D functional tissues or organs by accurately depositing the bioink. Bioink is actually composed of the biological materials and living cells. Now, let us talk about what is a bone regeneration. Bone regeneration is actually a complex biological process that restores bones' mechanical and functional properties. It also initiates the inflammatory response of the bones and progresses through a dynamic healing stages. Now, there is a certain process that the bioprinting in bone regeneration, which is firstly, we will design a scaffold that will fit the individual's defect. Then, it will lead to a cell growth in the scaffold, and it will then form the bone. Now, using this process, we are able to do a customizable scaffold that is curated to the individual. Now let us take a look at the bioprinting applications that involves in bone regeneration. Firstly, bioprinting in bone regeneration can be used for orthopedic surgeries, craniofacial reconstructions, and also bone cancer treatment. Now, we talked a lot about the bioprinting, but now let us go deeper and talk about the materials that is used in the bioprinting. Firstly, we use hydroxyapatite, which is able to mimic the mineral component of natural bone, calcium phosphate ceramics, which is excellent for bone integration, bioinks with stem cells, which promotes active tissue regeneration, and polymers like PLA or PCl, which provide the initial structure and degrade safely over time. Now, the benefits of bioprinting is that firstly, it's a patient-specific solution, where its personalized implant reduces the risk of rejection and fit better anatomically. Next, it also reduces surgery time. Pre-printed bone scaffold actually decreases the time needed in the operating room. This also less donor dependency, where it minimizes or eliminates the need for bone grafts from donors or other parts of the patient's body. And lastly, it also has a lower risk of infection, where there's a precise implant fit and biocompatible materials promote cleaner and faster healing. The current innovation and future outlooks of 3D bioprinting are 3D bioprinting can now use stem cells, which is cells that can differentiate into any cells that we want. And next, we can also use 3D bioprinting scaffold with vascularized blood vessels for faster bone regeneration and on-demand bioprinting during emergency surgeries. Now let us move on to the Q&A session. Now Mr. Ari, let us move on to the Q&A session where I will be testing you on your understanding on the presented infographic. Are you ready?
Yes, no.
Okay, now let us play the squeezes game. Okay. Now, the first question is, what are the potential benefits of using patient-specific bioprinted bone implants?
Reduce risk of rejection and better anatomical fit.
Yeah, this is the right answer. Now, let us move on to the second question. How might the ability to 3D bioprint during emergency surgeries or for bone cancer treatment change healthcare outcomes?
By reducing recovery time and improving surgical precision.
Okay. Yes, it is the right answer. Now let's move on to the third question. How does 3D bioprinting improve the process of bone regeneration compared to traditional methods like bone grafting?
It allows for customizable scaffolds and reduced surgery time.
Yes, that is the right answer. Now let's move on to the last question. Which material used in 3D bioprinting is known to mimic the mineral component of natural bone?
Hydroxyapatite.
Let's see. Yes, that is the right answer. Thank you, Mr. Ari, for joining me today in today's interview.
Thank you.